The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey everybody, welcome to Ageless Health with yours truly, Dr. Tom Roselle, and we got a great program for you today, as we always do, but we're going to let you start out the year understanding what your body's trying to tell you. And by the way, that leads into this coming Wednesday evening, the 14th presentation at the Roselle Center for Healing in Fairfax, Virginia. So if you're in the neighborhood, we'd love to have you here as a guest. And it's simply this: pick up the phone. You can call 703-698-7117. You can go online at rosellecare.com. You can go to drtomroselle.com, or you can click what you see in front of you and get it done that way. But the only thing that we ask of you, these events are our gift to you. And if you can't make it and you do register for the program, just simply call and say, hey, something came up and I can't make it there, so that way we can open it up. This is going to be a little different program. It's going to be yours truly only. I'm going to be sitting there and we're going to be talking about the 5 primary secrets of ageless health and what you have to do. But more importantly, what we're going to do is going to kind of talk about some of the things we're touching on today and the warning signs that your body needs to be aware of. You need to be aware of, not your body. Your body's already aware of it because it's causing some issues. And we're going to touch on those today. I want you to understand that there are things that you should not be ignoring for any reason whatsoever. If you ignore them, you're in trouble. And pretty soon you're going to wonder why you can't function. Your body says, hey, listen, I don't have the energy anymore. You go to your doctor, your doc says, oh, by the way, you're in congestive heart failure. Oh, by the way, you have diabetes. Oh, by the way, your autoimmune condition is getting much more progressive and so forth. You need to understand what the signs are, and you need to understand that there's a way to fix it. Your body's extraordinarily forgiving, and we have to make sure that we appreciate that and we honor that and begin to shift and change some of our lifestyles, if you will, to make things happen in a better way. So let's get into the program and talk about some of those warning signs that we may be ignoring. And they usually cascade. I want to start with one simply because we're seeing so many, if you will, congestive heart failure patients and things that have to do with the vascular pattern and circulatory pattern and so forth. So here's the deal. If you're starting to see shortness of breath and you're getting this heaviness in your chest, and it's a little bit more difficult for you to go upstairs or even coming downstairs or walk, into a grocery store like you used to, it may be a problem. And it could be something wrong with your heart. It could be something wrong with your fight-flight system called your adrenal system. It could be simply that, you're fighting something, but it also has other indicators. So what I want you to do is remember something. If those are persistent and you're feeling those things we just talked about, I want you to take a look at your earlobes or somebody that you love that's complaining those things on both sides. If you see a vertical line that's beginning to form deep into the earlobe itself, it's called a Frank line, F-R-A-N-K, Frank line. And the reason it got its name is some physician many years ago, his name was Frank, and he saw that when this vertical line was formed, that there was a significant correlation with cardiovascular disease. And subsequently, sometimes when it was ignored, the patient was in very devastating trouble. So if you have a Frank line, and then the next piece is take a look at the tip of the tongue. If the tip of the tongue is red, deeply red compared to the rest of the tongue, and you see these Frank lines, I can pretty much tell you with all the years of experience that I've had in clinical practice that that's something that you better check out and check it out very quickly, because it's telling you that your heart is under stress and you may be plugging up. So don't ignore that. Frank lines, vertical dimension in the earlobes, redness at the tip of the tongue, with other symptoms, particularly that are associated with that. Now, you can look at your nail beds too. If your nails are, what you see is you see a loss of that little white area down at the bottom, those little luna, these little moons that are sitting down there should be there. And all of your fingers for the most part. And if they're there, then your immune system is pretty strong. But if they start fading with the rest of this, it says that your immunological system is being compromised, and that could be affecting your heart as well. If you see little dots in your nail beds, those like little pinpoint white dots, they're those dots, those colonychias, what they're called, are a sign of zinc deficiency often, and actually most often. And so if you start stacking all these pieces of the puzzle, you better do something about it. Now, remember something, and I want to lead into this. Ageless health is a do-it-yourself program. What this simply means is this. Your body is a naturally forgiving organism, meaning that it repairs itself. It knows how to do it. That's why you were created. And if you were created in a way that you can repair things in what's around you, then you need to be aware of when things are starting to break down and not say, oh, well, it'll go away. Or if I take 2 aspirin, I'll feel better. If I take this antihistamine, I'll feel better. If I take this muscle relaxer, I'll feel better. But what happens if you don't and you're dependent on it? You keep having to take the same thing over and over and over again. What happens if that shortness of breath just doesn't go away and it seems to be a little bit worse over time? What happens if you're starting to see shifts and changes in the swelling around your feet and ankles? If it swells here low into the foot, start thinking kidney. If it's into the ankle and a little bit above it, start thinking heart. But neither one is any good for you. So you have to make sure that you are on post for you, that you notice, that you don't set it aside, that you don't say, oh, this is not a big deal. Understand that we're going to go over these in detail. I promise you, we're going to go through the point by point by point. I'm going to show you this is what happened. Join me this coming Wednesday evening, the 14th. Please, bring your questions and ask me questions about your blood work and what it really means, because I can promise you most of your traditional physicians are going to look at your blood work and say, oh, it's okay, as long as it was in the parameters. The problem is those parameters were, it's not the bell-shaped curve that you want. I'll tell you what's normal. I'll tell you what's functional medicine normal, and I'll tell you what's wrong. So bring your blood work with you, and we can talk about those things. I'm going to be sitting there. I'm going to go through the basics. I'm going to tell you how the body works. I'm going to tell you the signs and symptoms that you can't ignore. I'm going to say, hey, your body tells me X, Y, and Z. And I won't embarrass you. I promise you I won't do that. But I want to give you the data so you know how to fix it. So let's get into it. We talked a little bit about some real serious situations. How about when you have right in through here, you have these really dark areas, okay? And you have like suitcases, these bags around your eyes. You know what that's an indication of? That's called liver dysfunction, and it's starting to affect your kidney patterns. This is kidney right in here deep, kidney adrenal. And then through this area right here, this has to do with the inability to process stuff. You get those little deep, heavy bags in there. Yeah, not a good thing. That could be very suggestive, not absolute, that there may be a kidney problem. Now, if you get that, reddish nose and that reddish face and so forth, and it looks like you're in a state of stress all the time, that could be you drinking too much, my friends. And it's starting to affect, some really bad presentations over a period of time. If you don't do something about it, pretty soon you got a problem. What happens if you go to the doc? And I'm going to give you a laboratory finding. So let's say you have all of this, right? All of this nonsense that I just told you about. And you go to the doc and they do blood tests. And if they're, on point, they're going to do something called an A1C hemoglobin. What is that? That's the average blood sugar in your red blood cell over 3 months. So it's an average of 3 months. And if that A1C starts sneaking up, it starts getting 5.6, 5.7, by definition in functional medicine, you're already in a pre-diabetic stage. But what's the correlative? What is it that they should be running along with that shows you whether or not you've got a problem that's brewing? It's called a liver enzyme called LDH. So we look at both. So if the LDH is going up and your A1C is starting to jump up a little bit, that's a problem. And you've got to start doing some things with liver, pancreatic function, and blood sugar transport. And if you don't, you're going to be in trouble. You're going to go in a diabetic platform very quickly. Particularly, the finger pointing is that LDH level. So please understand that just because you're at the top end of normal, your doctor says, let's watch it. My brain always goes, watch what? Or it's really, really low and it should be that low. And they say, well, we'll run it again in, 4 or 5 months. Why? Let's take action now. Let's find out what the other sub fractions are so we can do something about it. So let's kind of go over what we just talked about a little bit. We talked about what? The diagonal lines here called Frank lines. We talked red tip on the tongue. We talked about these dark, puffy areas in here, real, real dark. By the way, those dark areas too, if they go all the way across, not all the way across, but halfway across, and there's just the dark areas, that's anemia. And it could be that you have enough iron, but you're not transporting. You're not getting into the system. Or your doc says you got a high ferritin level in your blood. Ferritin is a marker of iron. And say, well, if you don't get rid of it, you're exposing yourself to cardiovascular disease and so forth. Well, high ferritin levels also could be simply this. Some people, eat a ton of vegetables, and it'll drive that ferritin up. Yeah, vegetables will do it. And so you have to be able to distinguish it. That's not a bad thing. You just don't want it through the ceiling. So they're going to tell you, if your doctor says, oh, the only way it can be treated, you got to go give blood, once a month, once every 2 months, and drop that ferritin down and let your body reprogram it. There's other ways of doing that, and it's resolvable. So let's talk about what happens when these things, are ignored. It's called, you get really sick, you don't have the energy you're supposed to have, and guess what? You could die earlier than what you should. How about the pain in your neck and shoulders and that headache that just never goes away? You can modify it with drugs, but it just doesn't ever seem to want to stop. Particularly in today's world, everybody's on their what? They're on their iPads and their computers and their phones. They're walking around. I see people walking down the street and they're on their phone like this and they're walking. It's like, what the hell? What is it that you're so addictive to that dopamine spike that's causing you to be locked into those things? But do you know that it's causing your body to misfire? That there's an electromagnetic field called EMFs, electromagnetic fields, that will cause deterioration because you're in that all the time, and that the dopamine is being spiked because of that constant habit that you're in. So you don't have any interest in anything else. You need to have to that. You don't communicate with people the way you're supposed to. You don't get involved. So, but it can cause multiple systems to break down. All of a sudden you go into a depressive state, you go into an anxiety state, and simply because, oh my God, I don't have my phone. You want to see something that's crazy? Here's the deal. Next time you go to the grocery store, leave your phone at home. You heard me. Half of you are going, oh my God, what? Leave your phone at home. It's not going to hurt you for an hour and a half, 2 hours. I'll bet you can't do it. I'll bet you can't leave that phone sitting on your counter at home. And because if you don't have your phone, oh my God, back in the day, when I was growing up, we didn't have phones. We had party phones, the old rotary things like this. Hey, how are you? Type of thing. I bet you can't go without your phone if it's not on you. And then I'm one of the worst, right? So I sit there anytime I'm around, I take my phone and I put it down. Oh, by the way, I just showed you something. You see this little gizmo right up there? That's an EMF blocker. Even though that I rarely have it on me, I don't put it anywhere near me unless I have to. If I have a coat on, it goes in my outside jacket or my back pocket. As soon as I have an opportunity, it's out and I put it there. When I'm on the phone, I put it on speaker because I don't want it next to my head, because I don't want that blood-brain barrier to be disrupted. And all of a sudden you start to get headaches and you don't know why those headaches are there. This dull headache pattern. What's that all about? That could simply be your phone. It could be your computer screen. I'm sitting here right now doing this broadcast for you, and I'm probably about 3 feet away from my computer and the camera. And if I get a little closer, then I'm going to get the EMFs that are coming off the computer. Yes, there's EMFs coming off. And also the electromagnetic flux that if you're on the computer a lot, you should be wearing those, the blue glasses, the tinted ones that block that stuff and protect your eyes so you don't deteriorate the retina and things of that nature. Yeah, that happens too. So there's a lot you can do to protect yourself. And this coming Wednesday evening, the 14th, we're going to talk about why those headaches are persistent and don't go away. Could be an accident that happened years ago. Here's a young man that just came in to see me this last week. And he had a very significant accident. Oh, it goes back probably about 8-9 years ago. And this poor guy has, guess what? He can't swallow food the way he should. It gets stuck right about here. And he's always got this chronic headache in the back, very dull. It's always persistent. On a scale of 0 to 10, it's maybe a 2 or 3, but it never goes away no matter what he does. But he eats. He's been in the emergency room several times. He's had to go down, or they had to go down and pull the thing out. So I asked him a question. I said, when did this start? And he said, about 7-8 years ago. I said, okay, great. So within a year of that time, did you have any kind of accident, injury, a fall? Did you hit your head? He looked at me and said, why is that important? I said, seriously, what's the deal? And he said that, yeah, there was a car accident that took place. Now, how is this a sign and symptom of something that took place? Well, the nerves that control your food tube come from the base of your skull. And then there's nerves in the middle of your neck called the phrenic nerve. It comes from 3 different levels, and it goes to the diaphragm, but it goes to the food tube as well. So if that area is irritated because there was trauma or blow or something of that nature, guess what's going to happen? You're not going to be able to swallow the way you're supposed to. It's going to be a little bit more difficult. You say, why is eating such a problem for me? It never was. So you ask the right question and you find it's neurogenic. So your body's giving you signs and signals constantly. And we're going to get into the depth of this, but more importantly, I'm going to tell you what you can do about it. So if you have something that, here, let me give you one that is really important. If you cramp all the time, you turn over in bed and your foot tightens up, or you cramp and you got to be real careful how you move and so forth, that's often a magnesium deficiency. And it could be one of many different forms of calcium or magnesium, right? It could be magnesium glycinate, malate, it could be citrate and so forth. So you have to be aware that those are signals that are telling you that there's a problem. So if you're cramping, you turn over in bed, why is that an issue other than it's painful? It hurts. Well, that's one thing. It's going to give you all kinds of discomfort and so forth. And that can be eliminated pretty quickly. And it also may be an indicator of dehydration. But your heart, your brain, your joint spaces are suffering exponentially. Your heart needs magnesium, lots of it. Your brain, your nervous system needs magnesium, lots of it. So when you understand that these things are indicators, it's not just because you get old, it's because you're getting forgetful. You're not eating the way you're supposed to. It's catch as catch can. Why do you think older people lose a lot of weight? They become emaciated. It's called cachexia. That means the eating of the muscle. Why? Why does it do that? They don't have the cancer. They say, well, I'm just getting old. No, it's because you're not putting enough protein in your body. You need enough protein 2 times. When you're young and you're getting bigger, when you're old and you're breaking down, you need a lot more protein than you do at any other time of your life. So if you're not doing that, or I can't eat, I'm just not hungry anymore, it's because your system is not being supported properly. You're not getting the exercise that you need to. You're not creating the demand for it, but you still need the protein to survive because they convert into something called amino acids. If the amino acids are not present, nothing can repair, nothing can fix. And you say, well, it's just old age. No, it's not old age. It's you not wanting to do what it needs to do. So we're coming up to a break, by the way, and I want you to continue listening and make sure that you understand all this information is available at drtomroselle.com. And in addition to that, join me this coming Wednesday evening. We're going to have some fun together. So we went over through a lot of stuff. I'm going to continue the process as we go through today and give you a whole lot more information because it's important for you. We're coming up to a place where I want you to remember. I want you to remember what we talked about because the things that I've covered right now can save your life. Look at that earlobe. Look at that tongue. Look at what the face goes. Look at your fingernails. Start judging. Are you cramping up? All of those pieces are important. Don't go away because I'm going to add so much more to this, and join me this coming Wednesday evening. And I'm going to get into the depth of this. I'm going to answer your questions. You're listening to Ageless Health with yours truly, Dr. Tom Roselle. We'll be right back after some very important information. This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a do-it-yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
By now, we all know the number one cause of chronic and intractable health conditions is inflammation. Inflammation causes a decreased immune response that can lead to cancer, cardiovascular disease, insulin resistance, and degenerative loss of muscle and bone. But did you know the number one cause of chronic inflammation is lack of sleep? Multiple studies have concluded that stress, short sleep cycles, hormone imbalance, low blood sugar, chronic pain, and environmental issues like ambient light cause most sleep disturbances. However, according to a recent study, natural sleep at the same time every night is the secret to restoring health and increasing longevity. So what can you do? Sleep in a black, cool room. Don't drink any liquids for an hour before bedtime. Eat small amounts of protein before retiring. Cover your digital clock and never go to bed hungry.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use, so I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com. Hey, everybody, welcome. I'm here again, Ageless Health, with yours truly, Dr. Tom Roselle. And those of you just clicking in now and listening, you need to go back and re-listen to the beginning of the program. It's always available to you. Go to drtomroselle.com, is sitting there. And by the way, while you're in that site, drtomroselle.com or rosellecare.com, visit our online stores, because there's a lot of great products there that I recommend to you. And there's things for immune function and so forth. And right now we're going to be putting on, within a very short period of time, there'll be a place that you can purchase nutritional products and so forth that I recommend personally. And these are things that, if I won't take them, I'm not going to recommend them. If I'm not going to give them to my patients, I'm not going to recommend them to you. But there'll be things there that you can pick up. Basic things like vitamin D and B and so forth and so on. But having said that, check out the website. And it's spent a lot of time there. It's particularly in the rosellecare.com site. There's all kinds of data information. Let's get back into the program. We're talking about warning signs that you really can't ignore. And if you do ignore them, it's called shame on you, not a good thing. So let's dig deep into the program. If your health is going down the tubes and your health is declining very rapidly, and you don't know why, and nobody's been able to tell you why. We went through a whole lot of things in the first part of the program today. But here's the deal. You have to be your own guardian. You have to be aware. You can't just set things aside and say, oh, well, it's my age, or, things happen and so forth. Why don't you do this? Here's the deal. This could be very frightening for some of us. When you're at home, go into the bathroom, particularly if you have a full-length mirror, and take your clothes off. Ladies, you can keep your bra on and your underpants. Guys, strip down to your underwear. Nothing else, no pants, no shirts, nothing else. It's just for you. Nobody's in the room but you. And take a look at yourself in bright light and see what's in front of you. If you don't like it, what are you going to do about it? Your body wasn't meant to deteriorate. It wasn't meant to have the blemishes and the pimples and the dryness and all those scaly things that pop up and, the different carbuncles, as we call them, that are in every place of the body. Those are signs and symptoms of things that are not normal. It tells you your body's breaking down. If you end up with dry, scaly elbows, for example, and your eyebrows are thin on either side, and you go down and you feel your heels and they're cracked, but all of them together. And you notice that your face is getting a little, thick, if you will, a little puffy. Guess what? That's thyroid function. But it doesn't tell you whether it's hypo, doesn't tell you whether it's hyper, doesn't tell you whether it's Hashimoto's thyroiditis. It just tells you that your thyroid's not working the way it's supposed to. And if your thyroid's not working, you're probably putting on a little excess of very softness around your body because it's going to carry through the rest of your system. You're going to slow down. Mental capacity is not firing the way it's supposed to. All of those things are warning signs that something is not right, not working the way it's supposed to. How about that belly of yours? Is it just hard and bloated? And it's just this round thing that you can't get away from? Well, here's the deal. If it's up into this area here, that's called liver function. And then you start looking for those little red spots all over your body, and then they break down, they become little dark areas and so forth. That's another indication that you got a liver problem of some sort, showing up. If you have all of a sudden these hard little lines in the outside of we call the outer canthus of the eye, right? Guess what that is? It's the lateral portion of your eye, and that has to do with liver and gallbladder function. So belly, and then these guys, definitely liver. There's other indications as well. So why would you want to ignore that? Once you want to find out what you can do naturally and not wait till your doctor says you have fatty liver disease, or you're in liver failure, or, you better do something because you're going to die. I don't know about you, but I like to know about what's happening with me. I'm at that place in my life. I'm trying to figure out how to get another 30 years out of this place, maybe another 35. And we need to move forward. Look, here's the deal. If you ignore, shame on you. You're going to go down the tubes, period, end of story. If you are willing to do something on an ongoing basis to support your health, but be aware when you're looking at yourself, don't be the ostrich. Don't put your head in the sand. There's so much that you can do if you catch things. And who's going to catch it first? You or the doc that you never see? And by the way, in a couple of years, you're not even going to see the doc. It's going to be an AI somebody when you walk into the hospital or anyplace else. So you better get good at looking at you. You better get good at determining, am I healthy or am I not healthy? Is that belly something just because I've been eating too many damn sugars? Or is it because it's telling me that there's something else? You get that bloating, okay? You get that cramping, that gassy feeling. What's that all about? You should not have gas. You should not have bloating. You shouldn't smell like, the sulfur ion exchange from a heavy metal factory like, Bethlehem Steel many years ago in Buffalo, New York, and Pittsburgh. If those things are there, all kidding aside, if you have, little bleeding, your doctor says, well, it's a hemorrhoid. Or you put that together and all of a sudden you look at the lower part of your legs and you see that vascularity. That's your gut, my friends. That's your intestinal tract. So if that's the case, do you want it to go to cancer? Do you want it to go to irritable bowel disease? Do you want it to go to mucus colitis? Do you want it to go to Crohn's disease? All the things that affect the gut. Or you want to step up and say, hey, I better do something about it and do it quickly. It could be parasitic, could be abnormal microbiome. What's that? That's the good guys in your intestinal tract that give you your immune response. The bacteria that's supposed to be there, but you got all kinds of bad stuff. And then you go to say, well, my doc said I have SIBO. Great. What are you going to do about it? Well, they're going to give you a ton of antibiotics, to try to knock out the SIBO, and they're going to see if that works, except they're making it worse. Why are they making it worse? Because now they're killing off all the good guys that are even left. There's ways of figuring that out. Did you know that every organ system in your body is motivated, it's perpetuated, it's turned on by the spinal nerve roots. So if you have an injury to your back or to your spine, it's going to affect the gut. It's going to affect other things. Let's take it all the way down. We started up here and we're working our way down. Now we're in, the gut. We're in the intestinal system. What happens if, all of a sudden your urine begins to be like this color, dark, right? Not a good thing. I kind of like this color on me, but it's orange, it's dark, it's reddish, and so forth. That's not okay. So what does that mean? That means that your kidneys are not filtering. It could be not enough water. And many of you think water is just for washing. It's not for drinking. And you need a ton of water. And you wonder why your joints aren't flexible, because you need a ton of water and you're not even touching it. You brush your teeth with it, maybe. And, you spit it out, but you never get it in. Instead, you go for the coffee and the teas and, the sweet teas and all that nonsense. And there's no water in your body. And you wonder why your skin's dry. You wonder why you're cramping. You wonder why, your urine now is dark in color, or you don't urinate as often. Your kidney's not filtering. And you wonder why you feel sick, why you're tired all the time, why you're looking for more and more things to stimulate your alertness, tons of caffeine, and then the little shots that they have that are out there, and take this, take that, take the other. The reason I'm backing off is because I don't want to promote any product. I don't want you to accidentally think that I said, this is okay. But here's the deal. You have to be aware of you. If you got pain, guys, listen, let me tell you something. If you start slowing down your urination and you don't have that free flow like a horse, yeah, I know, it's very descriptive, isn't it? Well, here's the deal. Did you know that it's your prostate that may be starting to be problematic? And if it's your prostate, it may be because your zinc level is way too low. Did you know that the dry weight of the prostate is 50% zinc in a healthy man? And that sucker is being taken all over your body, helps repair, neurological regeneration, upregulating your immune response. It goes after viruses and stops it from duplicating. But it also needs to be there to help the production of testosterone from your testicular area. Now, don't ignore it, because it's going to then perpetuate itself in an irritation that can go. Next step is what? Prostate cancer. And we have all these things. How about, you're starting to notice, guys, these man boobs, right? Instead of being able to touch them nice and hard and solid, but you can go like this and you're jiggling all over the place. That's the conversion of testosterone into the bad testosterone and high levels of external estrogens. So you're starting to look like a woman and your libido goes down and so forth. Don't ignore that. That's called the beginning stages of potential prostate cancer and perhaps breast cancer. I know you've listened to the program. I've told you that breast cancer in men is on the rise. And depending on the author, 3 to 5% of all breast cancers today are male. Some will say 1 to 3%, but start looking at the European numbers, not the US numbers that the CDC likes to cover up. Just say it. But please don't ignore that. That's not okay. You're not supposed to get to an age where you look at yourself your genitalia and you look like you're back at 6, 7, it's not there anymore. That's telling you that your body's not working the way it's supposed to. Don't ignore it, because that testosterone level is so critical in repairing so many other things. Ladies, you have testosterone too. Your outer shell of your adrenal system is necessary to produce that. So if you're in fight flight, you're burned out, you got a problem there too. Brain function is dependent on it. If your testosterone level is low, men or women, you're not going to feel like doing much of anything else. So why don't we find out and make sure it's not converting into the bad guys? Ladies, if you get older and all of a sudden that your breast tissue is larger, you say, wow, I wish I would have had these when I was young. That's not normal. That's telling you that your hormones are off as well, and it can perpetuate into other situations. This coming Wednesday evening, if you're in the Washington metropolitan area, Fairfax, Virginia specifically, the Roselle Center, we're doing our first of the year in-house continuing education program. And I'm going to be talking about the 5 primary secrets of ageless health, or living well and long but I'm going to cover all this stuff. This is what we're going to be doing. I'm going to present some data, and then I'm going to ask questions. I'm going to answer your questions, and we're going to have some fun, but we're going to put it together. Whether it's pain, whether it's I don't feel good, I don't have any injury, I can't feel my feet anymore, I have numbness and tingling, I don't know where it came from, nobody's given me the answers, I've done this, I've done this, I've done this, and nothing works. Join me. I'm going to show you where the solutions lie. I'm going to show you how to put it together the way it's supposed to. If you do nothing more than learn how to look at you, you'll live much longer, you'll live well, you'll have energy, you'll be grateful that you're here, you'll have the motivation and enthusiasm to do things. But if you don't do it, guess what happens? You're going to wish that, maybe it's time. And then you go in that downward spin. And guess what? The body doesn't know the difference between an actual experience and then one you think about. So if you ignore all this stuff and you start feeling crappy and you get that headspace that, I wonder how much time I have left on the planet, and maybe it'll come a little sooner if I'm lucky. That's not the way you're supposed to live, friends. Not the way you're supposed to do it. You have to make sure that you understand what your body's trying to tell you. You have to make sure you understand that where you are right now is because of everything that took place before. It's really a do-it-yourself program. Make sure you understand, that your health that's going down the tubes ultimately will lead to a crazy diagnosis of heart failure, cancer, irritable bowel disease, diabetes, Crohn's, deteriorating osteoarthritis, any of those things. Look, if you want to have answers, you have to know where to start. Where you start is really understanding where you're at, and your body gives you every indicator across the board that something is happening. The only reason you get in trouble is because you ignore the communication. So let's not ignore it. Join me. I'll tell you what you need to do. I'll tell you what we need to move forward with. This is no joke, kids. Look, I don't know about you. I'm the guy that gets up in the morning and I start really getting myself into a really good place, and I communicate with, my creator and say, hey, show me the way. And then I look at me and I take a moment, I do a little exercise, I do some stretching, I go for a walk, I come back, I eat, and then I start my day. And my days are long, but I do a self-check on an ongoing basis. I look for those long vertical lines in my ears called Frank lines. I look at my face and so forth. Right now, I've been going and pushing. And this weekend, I'm shutting down, and I'm going to get some sleep, and I'm going to get some rest, and I'm going to get in a sauna, and I'm going to probably spend one of the days fasting because I need to get some stuff out. Wasn't that bad for the holidays. I was a little bad for the holidays. I'm the guy that, I don't get into a lot of sugar. It's not my thing. And, if I eat anything, it's going to be like a very small piece of dark chocolate, or I'll have a fig, or I'll have a piece of date. But the rest of that stuff doesn't impress me. I just don't get into it. But how about you that do? How about you that put on that holiday, 5 to 10 pounds, and you wonder why and why you're holding the water? What is it that you've been doing that did it? Don't you love yourself enough? Don't you want to change it? Don't you want to be aware of what you're doing? And then maybe at some point you can either get your life back, or if you do ignore it, maybe that life becomes ugly. You don't have the things that you want. But I give you a lot of indicators today. That belly that just doesn't go down no matter what you do, that bloating, that distension, that stuckness that you get when you try to swallow, the urinary problems that shouldn't be there, the stream slows down, or, other things much more significant. You look at your urine, it's really dark orange, or, heavily like that. Could it be blood? Could be. Could it be that back pain that you have with that type of situation might indicate that you have kidney problems of some sort? Could be. But let's put it together. Let's show you not only that it might be there, but look, here's the deal. If you ignore it, you're in trouble. So let's not ignore it. We're going to come back, and with the last segment of the program, I'm going to put it all together for you. We're going to break it down one piece at a time, show you what to do with it. I promise you, if you pay attention to yourself, you're going to be around a long time. If you don't pay attention to yourself, it's going to be a short journey. And I want you to have far more than that. That's why we do the program. You're listening to Ageless Health with Dr. Tom Roselle. That's me. And I want you to make sure that you have every opportunity to live well and to live long. Don't go away. We'll be right back after some very important messages. Are you looking for the most beneficial natural health and wellness products? Hi, this is Dr. Tom Roselle. My patients always ask me to recommend products that I personally use. So I've created an online health store at agelesshealthstore.com, where you'll find a variety of organic, non-GMO, and healthy, sustainable living products to help you achieve an optimal state of health and wellness. Shop agelesshealthstore.com today. That's agelesshealthstore.com.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Red wine is high in a substance called resveratrol. The so-called miracle molecule found in red wine might help improve mobility and prevent life-threatening falls among older people. Mobility problems are particularly common among older people who have Parkinson's disease and other age-related neurological disorders. The research says that this important finding could lead to the development of a natural group of products designed to help older Americans live safer and more productive lives. But before you stock up on red wine, Dr. Jane Kavanaugh says that you can get this naturally occurring substance in larger and pure amounts through dietary supplementation. Red grape juice, red grapes, blueberries, and nuts supply the same amount of resveratrol as red wine. If you're trying to stay upright, do core training exercise, eat your veggies, take resveratrol supplements, and drink red wine in moderation.
This health tip was brought to you by the Roselle Center for Healing. To learn more or to schedule a consultation, call 703-698-7117 or visit rosellecare.com.
Educate, engage, empower. Take control of your health with Dr. Tom Roselle and the Roselle Center for Healing. Information is power. Achieve an ultimate state of wellness with Dr. Tom Roselle's Education Lecture Series video on demand. Discover how to create an extraordinary life of optimal health and wellness. Visit drtomroselle.com/education. That's drtomroselle.com/education.
This is Dr. Tom Roselle, author of Ageless Health. Health is a do-it-yourself program. My book, now also available in audio version, is a step-by-step program of how to take control of your health and wellness without drugs or needless surgery. You have the capacity to change your health and level of well-being. Take control of your health today and order Health is a Do-It-Yourself program.
For more information and to order, please visit agelesshealthbook.com. That's agelesshealthbook.com.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Ageless Health with yours truly. We've covered a lot of stuff today, right? Tons of things. We're talking about, diagnosing the problem before it gets you to the place where you're kind of screwed, you're in trouble. And, the body's a beautiful thing. It can turn itself around at any time, but wouldn't it be great to look at it early on so you can make some corrections? We talked about your heart. We talked about your fight flight. We talked about your liver. We talked about your gonads. We talked about blood sugar transport and so forth and so on. And this Wednesday evening, the 14th, if you're in the Washington metro area and like to join me, I'm doing the kickoff in our office for the first in-house continuing education program for 2026. Let's have some fun together. Let's make it happen. We'll talk about your pains and your strains and your aches and your so forth. And I'll talk to you directly. You ask me the question, we're going to cover your problem. And it's not just an overall, we're going to give you overall stuff, but I want you to go away with data. I want you to go away with information. I want you to be able to understand what it is that you are responsible for and what needs to take place. So please join me and make sure that if you do decide to register, and hopefully you will, you'll be there with me, that if something comes up, just call and let us know that you can't make it. Okay. So let's get into it just a little bit of all the things that I want you to remember, that we covered today. And I want you to understand that you are your own physician. It's a do-it-yourself program. You have to understand what your body's trying to tell you before it goes down the tubes, before you start deteriorating. We talked about your earlobes, right? We called Frank lines, and we said the tip of the tongue, and we talked about chest pressure. If they're all there all at one time and your feet are starting to swell, what does that mean? That means you got a heart problem and you better do something about it. And I say, maybe have a heart problem? No, you got those things together, you got a heart problem. Something is not doing what it's supposed to be doing. God forbid you start getting that radiating pain into the left side. Ladies, by the way, we talk about arm and shoulder pain into your hand on the left being a heart. You can have that. But with you guys, when it's heart, believe it or not, for an interesting reason that we'll spend the rest of the program, but we won't talk about it. But I'll just tell you that if you get pain between your shoulder blades and you have that type of presentation, that's cardiovascular, that's heart. And you need to figure out what it is. So, but I want to warn you is that if you do go to the physician and you said, well, yeah, you got to take an aspirin, we're going to put you on a statin, we're going to put you on metoprolol, all these, and pretty soon you're on 5 different drugs. There's other ways of doing that. We have to find out if there's damage anywhere. And then it's a lifestyle shift and things that you can do. The only time you use medications is to save a life, not an ongoing maintenance program. People get into maintenance programs simply because of what? You're unwilling to make any changes. So if you're willing to make some changes and suddenly, and the data is out there, you can reverse virtually anything, or at least make it one heck of a lot better. So let's take those steps. And we'll talk about that this Wednesday evening. So please join me. But here, let's get into it. So this is the heart, right? We talked about the darkness in through this area. And if you get that, that upper belly bloating, start thinking about your liver. There's something not working the way it's supposed to. You take the enzymes, your normal liver enzymes, by the way, will only show up on a blood test if there's liver damage. That's the only time they show. So your SGOTs and your LDH and so forth and so on, as a group, will show if there's damage. You want to get it before that. There's functional testing that you can do to find out if phase 1 detoxification of the liver is working, if phase 1 is not working. Anytime you put anything that has caffeine in your body, you're in trouble. You're causing an inflammatory reaction. If phase 2 isn't clearing, you can't break down drugs. And so any drug that you take, no matter what it is going to be a problem. So is there a way of fixing it? Yep, absolutely 100%. And we're going to talk about this Wednesday evening. But things like glutathione and certain types of ionizable forms of B complex, things of that nature, cholines and so forth. It depends on what you test for. And the list is very long, but you can make a huge difference in your health if you understand what may be causing it. There could be absorption problems and so forth. We talked about your gonads, right? And we said, don't ignore the urinary color. If you're starting to see dark orangish type of urine coming out of you, that's called a sign. Don't ignore it. And particularly if you're drinking a lot of water, it may be that you're not drinking enough water, or you don't drink any water. Why don't you start drinking, a liter of water a day? See if it changes. A liter, you say, oh my God, I wash with water, but I don't drink this stuff. Well, guess what? You better start doing something. We talked about radiation poisoning, all the stuff that's around us. We talked about the headaches that you can get from it. We talked about, how you can blunt it. I showed you my cell phone, and there's a bug on it. And it's an EMF disruptor. Now, to get rid of it completely? No, but it makes a huge difference. So if we know there are things that we can do to shift and change our lives, the food that we eat, is loaded with all kinds of chemistry. And by the way, I am a very happy boy. Why am I happy? Well, at least the health department under Kennedy has taken an action in the last couple of days and I just hope they follow through with it. They've taken these 76 vaccines that are mandatory for children from age birth until 18 years of age. 76, they've skewed it down to 11. Thank you, Lord. 5 years from now, you're going to see this generation, if they hold true, that these kids that are born now that are not going to get the vaccines. And if you're a parent, do not, I beg you, do not do that 76 vaccine schedule, because you're going to see kids with all kinds of problems. But we're going to see healthier kids if they follow through. We're going to see healthier us if they follow through. And, the vaccines that they want, go get your flu shot, go get your this shot, go get that shot. Let me tell you something. The evidence is there. I want you to look it up. Remember, I've said over the years, my job is to provoke you. My job is to provoke you to do your own homework. Go out and get it done. look at both sides of the puzzle, go back and forth. Okay. So we need to understand that we are responsible for our own education. Go to the CDC fight. They've got all kinds of stuff there. And you go to NIH and you look at PubMed and read both sides of the puzzle. Do all those things. You owe it to yourself. You owe it to yourself to make sure that you understand what's being told, what's out there. And then you make your own decision. You decide. You decide if it's right. You decide if it's wrong. And if you just begin that process, you'll find that your health will be better and it won't break down so rapidly, so quickly, without you being able to stop the degradation and deterioration and so forth. So what do we do if we wanted to take away something? Get your butt up and go for a walk. Remember I said early on, see if you're addicted to your electronics dopamine, right? Leave your cell phone at home, go to the store and see if you don't, see if you freak out. And I'm not talking about all day long. I said one time, just take your phone, shove it on the counter, say, okay, phone, I'll be back, and see what happens with it. And then you take the next step and you sit there and say, well, maybe I can just leave it on the other side of the room and I can do something and go read a book. What a concept. Stay off your computer. Book, hardcover stuff. You don't look at it, read it. And some of you don't know what a book is, but old school like me, I've got a lot of books. You look at my house and it's tons and tons and tons and stuff. You look at behind me, this is just in my office. It's nothing compared to, I need 2 rooms this size to house my books. Get a little walk in. Watch the quality of food that you're eating. We've seen now that we're starting to modify and shift and change the quality of our foods by directive, because Kennedy's group is starting to say, okay, we got to get rid of this. We got to do that. We got to do the other thing. And I promise you're going to see healthier people because of it. Remember that, parasitic infections are huge. What is an indicator of parasites, right? There's a lot of them, but all the things I talked to you about, that bloating in your guts, those crustaceans and irritations and plaquing on your skin. Yep. All of those can be possible problems with parasitic infection. I was told the other day by a dentist and a patient that had gone to this dentist that when he pulled somebody's tooth that didn't look right, instead of doing a root canal, they pulled the tooth. What came out with it? A worm, a parasite. How does that get in your mouth? Well, if you like sushi, if you eat raw foods, if you don't wash the foods that you have, and then you don't brush afterwards, those parasitic patterns, those little bugs get into the teeth and they wrap themselves around the root and they can cause all kinds of problems. And that's one of the reasons that you lose your teeth. Ugly, huh? You go, oh my God, what? I'm never going to eat again. Well, let me tell you something. You can avoid all of that. You have to make sure you have to eat, obviously. You just have to know how to prepare your food. You have to know where to go. You have to make sure that you're not shoving your face full of all kinds of garbage, as they used to say back in the day. It's critical that you take control of your health, whether it's liver function, cardiovascular function, urinary, gonadal, low ED, if you will, erectile dysfunction, guys. So here's the deal. Coming up next week, 14th, 6 p.m. at the Roselle Center in Fairfax, Virginia. I'm going to do the leadoff for the in-house continuing education program. It's coming up this coming Wednesday evening, this Wednesday. Join me. I will have tons of data that I'm going to share with you. I promise you it's going to be like a fire hose. We're going to answer your questions. We're going to put it together. Make sure, that you bring pen and paper. We have paper. We'll give you a one-sheeter as well and a breakdown of stuff. But join me. I promise you, 2026, if you take action on the things that I'm going to talk about, you'll never be the same. Bring your blood work with you. Please bring your blood work and ask me questions from your blood work and say, hey, is this normal? We'll go over it. I promise you, we'll do it. Everybody's going to learn from it. And I'll tell you what you can do to fix it. This Wednesday evening, 6 p.m. at the Roselle Center for Healing in Fairfax, Virginia. It's going to be a great night. And I will stay as long as you want me to stay. I promise. And we'll answer everything that we can possibly can answer for you and put you on the road to the best health that you've ever experienced, maybe in years. I don't know about you, but like I said, I want another 30 plus years out of this planet, maybe more. And by the time that I learn more, maybe we'll get it done. But this one's for you. This is my gift to you. We're coming up to a break. We'll be here again next week, same old time, and with more programming for you. Remember, I'm here for one reason only. I love you all. Have a great day. Bye.